Good afternoon. How are you?
Doing well. How are you this afternoon?
Doing all right? Thank you.
Awesome. Well, we're so
Yeah.
glad to have you here today, Claire. I guess to start off, I'd love to hear a little bit about the journey that you've taken to get to where you are today. Um, I know that you haven't always been in the healthcare field, and this is an interesting time
Yeah.
to kind of move into that space.
Yes. Um, I've been in tech for a long time, but not in healthcare tech. So I started my career in Silicon Valley. I worked at companies like Netscape, Napster, and Comparison Shopping Engine. More recently, I worked at Udemy, which is a e-learning marketplace where our mission was to make learning accessible to everyone. And the reason I got into healthcare is because it's also mission driven field, right? Because healthcare actually has a lot of inequities. So Carbon Health mission is to provide um, quality healthcare for all. And I actually didn't understand as much when I joined the company what that mission really meant. And I essentially followed our founder, Aaron Bali, to Carbon Health. And Aaron was founder of Udemy. He started Udemy to democratize education. And then after leaving Udemy, he started Carbon Health to democratize healthcare. So, in a way, I followed him because I know what mission means to him, and he's very committed, and I wanted to be part of that mission. And providing quality healthcare for all is actually a very heavy mission. And I didn't feel that heaviness until I read more about it. And, I listened to some podcast learning about medical racism. And I know everybody knows by now, as we have gone through the pandemic, we realize how much of a disparity that exists in healthcare. Because initially, as you know, that many people from underserved communities were affected by COVID. So I think, I joined the company who wanted to do the right thing and wanted to provide the care for those communities. So when the pandemic hit, I think we were first to enable search terms like COVID testing near me. And then we opened many pop up clinics as well as testing sites, especially in places like Oakland and underserved communities of San Francisco, for us to really provide additional care for those communities. So I was really happy to join the company when Aaron asked me to join last December. So in January, I came on board just as City of LA, City of LA was, highly impacted with COVID cases in November, December, and they came to us asking whether we would help them power mass vaccination sites. So as I came in, within 2 weeks, we had to repurpose our application to serve City of LA. So Dodger Stadium and uh, five other sites and six other sites in LA. We powered them in the past 5 months, past 4.5 months, and we've administered over 1 million vaccinations since then.
Wow, that's incredible. It's no small feat to be able to really provide that level of resource to a city as large as LA, with as many different people and different experiences to be able to allow them to have the opportunity to get vaccinated is really incredible. Are there any things that you had to do or learn that may have been different than in other roles to be able to make this happen and to happen in such a short amount of time?
Oh, well, like at Udemy, providing learning was our mission, and also providing a platform for people who are passionate about teaching to also teach on our platform because it was a marketplace. But teaching and learning could stop for a couple of hours when the site is not performing well. But when that happens in a mass vaccination site or in our clinic, it really impacts our clinicians, our documenters, as well as our patients who are waiting to be served. So, this I felt the responsibility much more in this company And saving grace is that we actually have open hours and closed hours where we can do some of the major maintenance and database and stuff. Yeah.
Yeah. Well, even with, having some closed hours, I'm sure it became kind of an around the clock task for you and your team to accomplish, I would imagine.
Yes. Yeah, we do have 24-hour on call. And we are constantly answering and serving our clinic teams, our support teams, as the questions come up. So we've been on our toes. I tell our people, you are all on stage. We need to continue to dance and sing, and we're not going to bring the curtain down.
Yeah. The curtain doesn't get to close on this one, at least not for a little bit longer. What was it like then? You had mentioned previously when we were just chatting backstage about taking this from a relatively small team to growing it out to be able to have that curtain open at all times. What was that growth process like, and how were you able to find, the right people who had the same mission-driven purpose that you found in this company?
I got a lot of support from our talent team, and they did a lot of sourcing. And we also had, a lot of our engineers also come from bigger companies and joined Carbon because of the mission. So we had network of, our network of friends who are engineers. So we did sourcing from that network as well as just sourcing from the market. And like you said, I think the mission was the critical part of our hiring process. We are looking for, good engineering skills, but the culture part and how much they care about our mission and why they want to join us was a big part of our interview process. And, trying to build out a team during the pandemic, I think in a way, what some advantages that we had was that we decided in the beginning of the pandemic that we will go fully distributed as a team. So we started hiring people from pretty much anywhere in the world, as well as anywhere in the United States. So most of our, well, still, most of our engineers are in the States, but we opened our Turkey office. Aaron Bali, our founder, is from Turkey. So I had a team in Turkey back in Udemy. So we started another team in Turkey and hired best engineers coming out of school, as well as engineers working in the industry. So we started our Turkey team, and that team is up to 12 engineers now. And we hired from pretty much anywhere where we could find good people. So I have engineers in Georgia, Florida, New Jersey, Michigan, Colorado. So yeah, and still we have quite a few engineers in the San Francisco Bay Area.
Okay. Very cool. Very unique to have, a team in Turkey and getting to work with them and getting to kind of reiterate that process from your experience at Udemy had to be maybe a little bit of a comfort, at least, because it wasn't totally new moving into this. What kind of innovation do you think is going to come out into the healthcare and the health tech space because of this rapid iterations and these rapid changes we've had to face over the last 12 to 18 months?
Oh, I think I think the changes that's been happening already are going to get accelerated. Really focusing on patient care and applying the fact that if you take care of the patients just regularly, and if you take care of them well, and if you have healthy patients, when something like pandemic hits, it's easier to provide that care, as well as they're healthier to be able to handle the pandemic and recover from it. So I think a lot of healthcare is moving to continuous preventive care. So if you provide good healthcare in general, then there will be less emergency room visits or less, emergency surgeries and all that. And those things all lowers the cost of healthcare. So I think, and also keep your patients healthy and meeting the patients where they are, because some of them cannot necessarily get to the clinics. You know, a lot of uh, lot of people in America actually do not live close to a hospital or clinics, right? So providing virtual care and being able to do home-based care now that we have all these devices. So you could monitor A1C, you could for diabetes patients, you could we were able to give out like oxygen monitoring kit to patients who were diagnosed with COVID during the COVID period. So we could actually collect that data either, you know, automatically or through patient entry, and you could just provide a better monitoring of the patient's conditions and meet their healthcare needs.
Do you see Carbon Health being able to be a leader moving into this very patient specific and very patient focused and preventive care space, especially as you mentioned before, for marginalized communities?
I believe, I mean, that's our mission, and I believe we're uniquely positioned to do that because of where we're coming from and how, you know, how much commitment we have behind that. And so more recently, we started looking at our DEIB initiative and our commitment to it. And when we start to talk about this, um, I think for us, the biggest motivation is let's first create an environment where we really value diversity, equity, inclusion, and belonging for our employees, which is including all our clinicians and our patient facing, you know, our frontline staff. I'm in a service role as an engineer. The people who do the hard work are in our clinics and our vaccination sites. And that, you know, if we take care of all of them and also educate everyone, how important that is, then, you know, that inclusivity and that belonging will go out to our patients so that we welcome those patients to come to our clinics and we treat them equitably in terms of providing that care. So I think we're a company that really cares about that, how we care for our patients, how we treat them equitably and with a lot of empathy. So I think that's the first reason why I think we are better positioned to serve those communities. And secondly, our clinicians are just amazing. I, on a daily basis, I am so thankful. I work with such amazing people who really care about our patients. And we get a lot of, we do NPS survey for every visit. So we get a lot of feedback from our patients and we share some of the highlights in our all hands every other week. And it's always very heartening that we are part of that organization that's serving patients in need.
Very cool. And I love hearing you say that it really starts with how you treat the people within your company, and that extends to how you treat your patients. That's a great way to kind of model both within your company and to show those people, your employees, that their health and their experiences also matter. It's not just the customer that you're serving. What's it trying to lead this team? I'm sure it's not been something that you've done completely on your own. You have other mentors, other people that you work with. What has that experience been like over even just the last 5 months since you've joined the company?
Yeah. Oh, I'm humbled every day. And I feel so fortunate to have the team that I have and been able to build the team that we have today. So, you know, as I joined the company, there were some amazing engineering leaders here already. So it was a matter of us like working together to build the, you know, next set of engineers that we're going to onboard. We were very lucky to have, when I joined, we had one woman engineer, but she was just amazing. Her name is Hannah. And she had, as soon as she joined, she didn't appreciate the onboarding program we had. I think she was like engineer number 9 or 10. I don't think we had that many engineers when she joined. And clearly we didn't have a good onboarding program. So she actually took the initiative to put a whole onboarding program together, recorded videos of like architectural talks or like overview, and got people to do all these presentations and record it, as well as pull together a bunch of documentations and actually put a program in place. Like on day one, you'll do this, on day two, you'll do this, here's our toy project and all that. So I think we were so lucky to have Hannah when we did, and she put a whole program together. So there was an onboarding program already when I joined. So I think we were able to onboard, next sets of engineers through that onboarding program. And in February, Hannah did this because she felt the need, but she wanted to go back being an engineer. So in February, I hired the women engineering manager who was willing to take that on. So Bosma came on board, and she's really made the program even better and added, a lot of documentation around best practices and our engineering processes where we need improvements or, more standards on what we do. So focusing on developer productivity, how do we help our developers be productive? So we are, I think we're building the team that we want to be part of. We ourselves want to be part of. It's a very inclusive team that is very open to feedback, and there's always teaching moments and learning moments in our lives. And I think we're focusing on also how can we do our job of serving our patients and our clinicians better, being more conscientious of testing and robustness and scalability and performance of our application.
Very cool.
So it's been an amazing experience.
Yeah, that sounds incredible. And to think about someone having the initiative to kind of build out the program that they wish they had seen when they were onboarded is really cool. And it speaks even more to the company that she had that opportunity to be able to do that within her role as well. And it was very interesting to me when you mentioned, you're building an inclusive team. And as a female engineer, I'm no stranger to walking into a room being the only female in a room of other engineers. So engineering has not always been known to be the most inclusive environment. So was there anything that you had to kind of work through, or what did it take to build out that culture of inclusivity within your engineering team? Or was that part of the company as a whole, even when you started?
I think the people that we have hired always had those best intentions, but didn't have chance to practice, perhaps. So I think through conversations and coaching, just clearly specifying our intentions to really create an amazing DEIB organization, I think we're making incremental steps. So for example, our interview process was standard, like tech interview process where you'll be asked either, architecture questions or algorithm questions, data structures questions or whatnot. So that was kind of a one way we did interviews of our engineers. And I think from our own group, there was a suggestion, maybe we should look at other ways to interview people to be more inclusive, right? So we put in like project-based interviews where people can come with their own project and present it and take questions, and that could be the interview process. Or we could also provide a homework project that's no more than 2 hours. So instead of being on their feet and being nervous about thinking on your seat these days on Zoom, having to answer those questions, they could actually do it within their own home and own time and turn it in. So we try to expand ways that we could be more inclusive in our own interview process. And I always say that the interview is not the best representation of how they will perform. when they join the company. So when there are like mixed results of interview from the interview panel, then we also do reference checks to see whether that person will do well in our environment.
Very cool. I love the idea of alternatives to just the standard, show us what you know based on our, one set grading criteria. That's incredible. So you also are doing a lot of good just beyond carbon health with many of the other communities that you're involved in. And I'm sure that you also didn't get to where you are today without the help of others along the way. And your leadership style, from what you've kind of discussed here today, really points to that as well. Can you think about and maybe share some of the mentorship or leadership tips that you would have for anybody working with engineers?
I think it's always I think it's always encouraged for people to have a mentor, especially if they're seeking one, or having someone outside of the company, because more allies you have, more supporters you have, then there are more places you could go to get advice, or even to just talk about your stress or how you might handle different situations and all that. And I've been a mentor, I've been a mentee, and anyone, I have to say that I think anyone has an opportunity to be a mentor. Like, whether, even if you're a junior engineer, there are people in college or people in high school who are looking for that mentorship, looking at like, how did you get there? Or how did you end up majoring in engineering type of thing? So I want to encourage everyone to take that opportunity to mentor, because it actually gives you back more than you give. That satisfaction of really being able to help someone and be able to influence, but their experience, the mentee's experience and their background could also teach you a lot, because we all have different experiences and different backgrounds.
Is this kind of what led you to being a part of or helping start Persistence?
Yeah, so Persistence is a women's organization. It's a women leadership organization. And we wanted to really provide a community more than anything else, where women can get together, and women with like-mindedness. So we all want to grow. We want to all continue to grow and learn. And we are just looking for that support from each other. And we want to also raise them all up in terms of like being able to refer people from Persistence to board positions, or refer them to other executive positions and all that. Because there's a lot of that happening among men. They go out and they work out together, or they play golf together, and they do a lot of that. And we wanted to provide a community of women who do that for each other. So yeah, we meet and we provide support, and we bring in speakers. So it's a community we formed. I also belong to Diversity. It's a DIVHER city, SITY. And that's a group specifically formed to get more women, more engineering women into VP ranks and above. So they provide mentoring and also community.
Very cool. Two great things to be a part of. One, obviously, you helped start. I love the idea because I often look around and am lucky to be in a research lab where there's a lot of other women engineers, but I know that that's not often the case. And the idea of knowing that these communities exist is really motivating, at least for someone like me who hopes to see a future in that space, who sees a career there long term. I also wanted to ask, or kind of go back to what you had said earlier on. You were talking about being very mission driven, and mission being, serving something broader than yourself. Can you see ties to what you define as mission, both in your career and in these other organizations and other opportunities that you've been pursuing? And kind of how did you shape that over time? How have you seen that change as you've had new life experiences?
I think early in my career, I think I was more, I cared more about working on cool stuff. Like people would think, oh, that's cool. Or, I, so kind of being involved with more innovative platforms, or, I clearly went to Netscape and Napster, which were back then very well-known companies who were considered to be very innovative. And I'm sure we served some mission-driven customers, but it was more of a technology company. I think as I progressed in my career, I noticed how much more motivated and engaged I am when I am aligned with the mission. That um, just getting up in the morning and going to work was a lot more satisfying when I worked for Udemy. And actually, early in my career, I worked on 911 emergency systems. So, clearly that's mission driven and that's actually saving lives. And, I compared how I was looking at my day-to-day life and how I was contributing when I worked for those mission driven companies versus just more revenue or, other purpose driven companies. And I just um, my engagement and happiness and performance was, I think, much greater when I worked for mission-driven companies. So I specifically looked for those, try to find the mission that I could align with when I'm looking for a job these days.
Yeah, incredible. Do you have any advice for someone who maybe, healthcare isn't the mission's kind of space that they see themselves in, but for how somebody can start looking for that within their careers?
Yeah, I think it's important to think about what you're motivated by. I'm sure like as an engineer, the engineering's applied pretty much everywhere and anywhere. So how you want to apply the skills, I think thinking about that and actually taking the time to look around because there are many mission-driven companies or initiatives out there, and just really applying for those companies. So we're still hiring, so please, please look at our job openings. And I think and also some companies just have a mission, but maybe not not as focused on their mission. They do have a mission because they have a mission statement, but, is everybody rallying behind it? Is this really core part of this company? Is that their North Star? It's something you could evaluate during the interview process.
Great
So I
advice.
think, yeah, keep looking because as an engineer, you have many choices and just don't settle for something you don't feel you're going to be motivated by. And don't stay in a company where they don't, help you learn and grow and make you feel belong. I mean, everyone deserves that. So yeah, don't
Absolutely.
settle.
Don't settle. I think that's probably been one of the most reiterated themes throughout this whole summit of don't settle. As women in the engineering space or any space that we may find ourselves in, we don't have to settle for what's handed to us. We can pursue the doors that we.
Yeah.
To wrap us up, I know we are, I believe, finished on time, but is there any last bit of advice that you would have for either health tech founders just getting started in the space, for those who've been in the health tech field for several years, or those who don't even know kind of what direction they want to go, for how to keep moving forward, for what they should look for next?
I think there's so much more to be done in healthcare, right? I mean, there are a lot of inequities or, not such great quality healthcare out there. So I welcome more people to start healthcare companies but really focus on the patient, what they need, and also like what does that mean to provide that higher quality healthcare? Uh, and whatever you're building to provide that, really focus on quality. Like, healthcare data is pretty messy. So it's hard to really get good data. So one of my mission is like, let's build in data integrity from the get-go of where we collect data and how we leverage data.
Speaking my language right there with all things data. Well, I think that's the perfect place for us to end today. Claire, it was such a pleasure getting to talk to you and getting to hear more about carbon health and your experiences as a CTO. So thank you so much for being here.
Thank you for having me.